Thank you very much, Mr. Chairman. Mr. Brown summarized your explanation regarding deep dives by saying you had some supervisory responsibilities. Did you indeed have supervisory responsibilities?
I would not define it that way. I was an advisor assisting CMS. But CMS was responsible for delivering the federally facilitated marketplace and the new Healthcare.gov.
How would you describe your work on Healthcare.gov during your tenure there at CTO?
Yes. So we're talking about the new Healthcare.gov, the federally facilitated marketplace. I would again describe it as I referred to in my opening testimony. I assisted CMS in a few different capacities, serving as a co-chair of this interagency steering committee, focused on providing a venue for agencies to work together on interagency issues in support of the hub, assisting with the red team exercise and follow-up to the red team exercise that summer, serving on from time to time as a spokesperson, as a liaison, as someone who could help with particular questions. I began as an assistant, as an advisor to CMS, and certainly not as the person who is the hands-on project manager running the thing. I was doing this assistance work as I was fulfilling my much broader portfolio of duties as technology policy and innovation advisor at the White House.
Could you give me a little idea as to what that broader responsibility for being the Chief Technology Officer over and above or around or in conjunction with, or whatever way you want to put it, for the .gov program for the healthcare?
Yes, ma'am. As U.S. CTO, my job was to be a tech policy and innovation advisor at the White House, focused on how can technological innovation help build a brighter future, create a brighter future for the country and for the American people. There was a wide range of initiatives that I worked on and championed. So you mentioned one in your opening statement. I mentioned a few, but the open data policy, open data initiatives work of the administration, which really focused on opening up the information and knowledge in the vaults of the federal government, such as weather data, health data, energy data, public safety data, et cetera, as machine-readable fuel that taxpayers had paid for, and returning it back to the American people and American entrepreneurs and American innovators and researchers to turn into all kinds of incredible new products, services, and companies that help people and that create jobs. I also was one of the creators and leaders of the Presidential Innovation Fellows Program, which was an effort to bring in the most amazing technologists and tech entrepreneurs from outside government and team them up with the best people inside government to work on projects like Blue Button, which has enabled I think well over 100 million Americans to be able to download copies of their own health information. I did a whole bunch of work in figuring out how we could tap into the ingenuity of the private sector and nonprofit sector to help use the power of technology to fight the evil of human trafficking, to help improve disaster recovery and response and other key priorities. I worked on policy issues like how do you advance a free and open internet, how do you actually massively improve the supply of and utilization of wireless spectrum available to the country, and more. It's the most amazing experience I've ever had.
It appears to me that though you were a person that could be asked a question or included in a loop, that your responsibilities were really very broad and really had no key responsibility toward Healthcare.gov.
So there was a chunk of my time that I reserved for basically being helpful, being an advisor on issues that came up beyond the initiatives that I was championing or co-championing. And that's the bucket in which I put being helpful to CMS on Healthcare.gov, which I did try to do in the capacities that I described.
Thank you very much. I yield back, Mr. Chairman.